Good day, and thank you very much to CRE-MSD for inviting us to come and share our experiences from Sudbury Paramedic Service on the development of our back care program.
Back injuries in paramedics. The BC's WorkSafe statistics published in 2012 demonstrated that those people in the healthcare and medicine suffer the highest rate of back care injuries at 33% reported injuries in the workplace. Continuing on with the statistics from the U.S., we see that the paramedics and EMTs have 3 times the national average of injuries. There are some other statistics there, but I think we pretty well, I think we pretty well would know those. We all know that back injuries are the leading cause of online duty injuries among paramedics, and many paramedics do not retire as a result of this and additional injuries.
So in Sudbury, what we determined to do was to look at our own statistics. And so from 2013 to 2015, we looked at our injuries, and we determined that 30% of our injury claims were attributed directly to lifting stretchers. And we looked at calls and averaged that on our calls, we were doing approximately 8 lifts. And our average patient weight at that time was approximately 80 kilograms, and certainly we had patients that weighed more than that, as most services did. And the 80 kilograms were averaging for us old people that still thought in pounds was about 176 pounds. And when we looked at the total weight, combining with the stretcher and the medical equipment, we were looking at 385 pounds on the lifts. So as we were looking at these injury rates resulting from the physically demanding work that our paramedics did, it was a significant concern to the management team. So we identified this as part of our strategic and tactical plan, and it was a key priority to present forward to council. And we needed to look for a solution, and the solution included education and training for physical and back health as well as mental health for our paramedics. We wanted a linkage between mental and physical health. We wanted a holistic approach, an all-way approach. We wanted to improve the awareness of health and safety and working safely for our frontline paramedics. And we also wanted to find an alternative powered solution to reduce the accumulative effects of repeated lifting. So with the beginning, what we first did was we had a number of wellness facilities that were owned by the city. So the first thing we did was open all those wellness facilities for all our paramedics to enter freely, to encourage fitness. We partnered with OCAL, and we'll go into more depth with that, and QP 4705 to develop the guidelines as a foundation. We worked with body mechanics and practical training for all frontline paramedics and with our corporate kinesiologists. We involved our paramedic advisory committee on equipment and power stretcher evaluation and selection process. And then again, we did an injury stat review and analysis. So as you will see, our program is multifaceted and looked at several initiatives such as awareness, education, and technology. In about 2008, Jennifer, I attended a workshop put on by OCAL, an MDS workshop. Together, we decided that we wanted to further that, develop a program that could be used in conjunction with other adjuncts to promote health and safety and back care amongst the staff members. The development group did include the union, me as a representative, the city, the health and safety sections, and various other individuals, along with the Occupational Healthcare Clinics of Ontario. I'm just used to calling them OCAL. So we initially started with the ergonomics from Steve McDonald, who works at OCAL, and along with Trevor Schell. Additional people who came along the way were the kinesiologists of Miri Freeman, Jacques Barbeau. These are individuals who are on staff at the region to provide assistance in development.
along with myself and Rick Sasseville, who were the union representatives. We also had Jennifer and Marianne Matichuk, who was at that time the health and safety coordinator within the region, who was very much behind this program. This program was reviewed by the QP National, and I'd like to give a shout out to Andre Chenier and Troy Winters to help us further this program, which actually is rolled out provincially, and actually, surprisingly, I know that statistics, but actually another province had actually picked up the program in review of it.
So currently, there's 30 services in Ontario that have accessed the program, and it's also been translated into French, and it's in New Brunswick as well.
It's our first time at it for a long time, sorry. Again, as I would like to say, this program was never intended to be a standalone program. The program designed with OCAL and in consultation with the management team was to be able to be put together with different sections. It also, dealing with the OCAL, they wanted to bring it provincial-wide so that it allows the ability for individual services to adjust it to their working environment.
And as with any health and safety initiative, sometimes you need to have a knowledge transfer opportunity. So instead of doing the regular, question answer, actually it was a suggestion from the union that we make it fun. So it ended up being a crossword puzzle. And for anybody that's interested in accessing the program that hasn't done so already, it can be accessed through the Sudbury OCAL branch. And the person to reach is on the online there. It's Trevor Shell, and it can be personalized for each of your services. So it's still available, and if you would like to have it personalized for your service to be able to access the crossword puzzle, you just contact Trevor Shell.
In January 2014, the OCAL program went online. 2014 overview of safe lifting practices, body mechanics, training, muscle recruitment, and communications. Continuing on in 2014-15 in our training sessions, practical demos with backboards and stair chairs involving the ergonomics. Thank you. I keep on doing that. Staff to actually point out, and even other paramedics, kind of like a little round table, pointing out little bits and pieces of where staff members were maybe not watching how they were lifting, because we do all fall into bad habits. That's true. Moving on into 2015, another component that was brought in line was dealing with diet, exercise, and the pitfalls of shift work, which we all do recognize, and I am a poster child for the diet part. The assessment also carried on into workstations and the purchase of ergonomic chairs and the stations themselves to make documentation a little bit easier and more adaptable to the crews.
So as we carried on with our prevention steps, again, it was a multifaceted approach. We had done with the didactics. We had the practical review with the ergonomists dealing and having the paramedics utilize recruitment of muscles, keeping the spine straight, doing their lifting, giving them tips and techniques for lifting safely. We were looking at equipment change, encouraging personal fitness and wellness techniques, dealing with shift work, eating proper nutrition, diet, exercise. We reviewed and trialed equipment options, and we have what we call the Paramedic Advisory Committee. And the Paramedic Advisory Committee is made up of paramedics from each rotation, and they serve for a 2-year term, and each each year we're changing out paramedics. So there's new faces, and people that are interested kind of submit their names, and then they're literally drawn out of a hat. So it's certainly randomized people that serve on this committee. And they bring us forward great ideas, and they assist us in any RFP process. So the Paramedic Advisory Committee have helped us with the selection of anything from uniforms right up into the selection of our powered stretchers and lift assist. So during our field trials, we trialed different models of power stretchers and stair chairs prior to purchase. And these paramedics often become our champions. So they go out as the first trained people, and they help with the evaluations, the field evaluations, and the buy-in from the rest of the staff. So these were some of the field trials. These were some of the field trials that we did. We, of course, started off with the number 30 in the beginning of my career. We moved to the 35As and then the ProFlex. And we moved to the power stretchers with Furno. And then we trialed the Stryker power stretchers. And we moved from the evaluation of the Stryker Power Pro, the results of the evaluation based on the PAC and the people that were doing the field evaluations. We went with a service-wide purchase of the Stryker Power Cot XT and the Power Load Cot Fastener System. Stair chairs, we started off with a Model 42 that I think everybody had. We went to the Model 242 with the extended handles, which assisted especially when you had the different heights of paramedics. However, we did find those a little bit tight in some of our smaller apartments, that we'd get down the chairs and come around the corner, and all of a sudden, we couldn't make quite that corner with the extended handles, so it was a little bit of a learning curve. And now we tried the Easy Glide 59T, and now we're considering trialing their power stair chair. Vehicle design, we've also gone with the vehicle lowering system. However, we determined that the airbag suspension did not work that well in Northern Ontario, and I expect that's due to the temperature extremes, so we are not purchasing that option in the future. Cab seats, we started off with the OBIS trial form, and because of the lack of lumbar support, and we are now purchasing upgraded seats, the electronic controls with the adjustable lumbar support. And finally, we have moved away from the bench seat. As you can see, we have the sliding captain's chair in the back. And it does move forward so that you can provide patient care without reaching over. And the paramedics hopefully remain belted, and we haven't really done a full study on that. So that brings us to our lessons learned. We certainly have learned the importance of teamwork, and you need to listen to the boots in the street, because those are the people that are doing the job, and they can provide valuable insight. And when you listen to the boots in the street, you gain acceptance of change. Not all methods work as originally planned. You have to be ready to change. You have to be ready to change with technology. Trial and field review new equipment to determine if that equipment will work in your environment. Sometimes it doesn't always work as advertised. The general health and wellness can impact your risk of injury, and there's always room for improvement. Obtain your expertise from ergonomists and kinesiologists. Their clinical knowledge in body mechanics certainly assists you in program development, and you can obtain that through agencies such as OCAL or your universities. CRE-MSD has been great. Even when we were working on the OCAL program, and I was a member of Section 21, I brought the draft document to Section 21 And our co-members of Section 21 looked at it, and actually Dr. Rennie McPhee looked at the draft document for us as well and provided feedback. So, there's lots of people out there that are very interested in our career and want to help us remain safe and healthy, because we do an important job out there. Take advantage of the people that do want to help and make it a team. Technology improvements take time. We had done some preliminary reviews of very early models of power stretchers, and the battery life was terrible. And they were very heavy and very awkward. So paramedics were a little, had some misgivings when we said, oh, come on, let's try this new power stretcher. And they're going, yeah, right. But like any technology, it gets better with time. So if you've had some poor experiences at the very beginning, give it a try, because they're always looking to try and make improvements. So this was our analysis for our injury stats, and they've been very good for after our full implementation of the Stryker Power Cot and Power Lift system. So when we're looking at our injuries, 2014, April 2014 to March 31st, 2015, you'll look at the number of lifting incidents, 44 to 25. So that's quite a change. That's not specific to stretcher, that's lifting incidents of any kind. And now when you're looking at 2015 to 2016, a number with a stretcher, you're looking at 21 to 5. Now, I'll also stipulate that the 5, none of them are with the power cot. Those are with number 9 stretchers and incubators at the airport. We do 5,000 airport transports a year. Sudbury is the receiving center for northeastern Ontario, so we get a lot of airport transports. So those are specific with number 9s and incubators. And the other one we were looking at, we kind of wanted to drill down specifically for back injuries. So 2014 to March 31st, 2015, we went from 23 to 21, and we've gone down from 13 to 11. So load handling, your red is back injuries, while load handling, and your blue is just straight back injuries. So back injuries could happen, slips, trips, and you twist your back, or getting in and out. A lot of those are still with bags. We're still looking at the way we're handling bags. ACPs are still carrying the backpacks, and hey, I was an ACP and I did it myself. Sling it over one shoulder instead of putting it on properly. And as a result, we get injured that way. So what are our next steps? Our next steps is to continue training on proper lifting techniques, continue to model. We certainly put all our new employees through the OCAL program. We do have them assessed and worked with during the hiring process on proper lifting techniques with our kinesiologists. We are still promoting physical fitness and proper nutrition, and we're evaluating the power stair chair to further reduce injuries among our staff. Thank you very much.